So very warm welcome, everybody. This is our research showcase talk by Dr. Bina Ogbebor, who is a lecturer in our department. So this talk is going to be about the COVID-19 infodemic in Nigerians' WhatsApp communities. Bina joined the University of Sheffield in February 2020 as a lecturer in journalism studies. And before then, she worked at Cardiff University and also for several years worked as a TV reporter, news editor, and producer and presenter before moving into higher education. Bina's research and teaching interests include critical incidents in journalism, media representation, media policy, media and democracy, the public sphere, self-coverage, among others. Bina is a recipient of several scholarship awards, including the British Chevening Scholarship and the Cardiff University Geoff Mangum Award. She is also the organizer of the prestigious Future of Journalism Conference in 2019. So today, Bina will be talking about her recent and very timely study, which was done in collaboration with Nuhu Diraso Gapsiso from the University of Maiduguri, Nigeria. And the study explores the COVID-19 epidemic and the Nigerian WhatsApp communities. So Bina, a very warm welcome, and I'm handing over to you.
Okay, thank you very much, Dimitri. And thanks to everyone who's come today to listen to our research findings. We really appreciate it coming. I want to specifically thank the research participants. I also want to thank Dr. Nuhu and his students and his colleagues as well. So today, like Dimitri said, I'll be talking about COVID-19 infodemic in Nigerians' WhatsApp communities. I'm going to be focusing on an aspect of a larger study which we did on Black people COVID-19 infodemic in Nigerians' WhatsApp communities. So this is how the study, the presentation is going to go today. I'm going to begin with an introduction. I'll talk about why we decided to go into the study. And then I'll introduce the research question briefly, and also the theory briefly. I'll spend more time on the methodology and the findings, and I'm happy to take questions at the end. So, why did we go into the study? At the peak of the coronavirus, we noticed, myself and Nuhu, as people who belong to several WhatsApp groups consisting of Nigerians, we just noticed that there was so much information within this space. And within this closed communication space, people felt free to say things that they would not ordinarily say in other circles. So there was a lot going on there. There was accurate information, inaccurate information, so much. And when we looked at the responses to people, some of these messages, people begin to respond to them, react to them. It was really a huge cause for concern because we identified a very huge amount of lack of trust among the people within this people group in the WhatsApp communities. And we felt that it was a very serious thing because of globalization, that if such information was really spreading so much and we did not know how people may respond to them, it was then going to become a problem in efforts trying to stop the spread of emerging infectious diseases. So looking at infodemic, by infodemic we mean huge amount of information that are spreading, huge spread, rapid spread of information about a disease, and in this case, the coronavirus. So when we looked at this, we felt it was very important for us to study the content of these messages, to also look at the perspectives of the people that receive these messages. And we felt it was good to look at that in closed circles because that's where sometimes people say things they wouldn't say in the open. And because over 90% of Nigerians who use the internet on WhatsApp, so many Nigerians on WhatsApp, we felt it was good to study this people group within WhatsApp. And we know that Nigerians are really high in population. They're the largest Black population in the UK, and also very largest population as well, a Black population as well, if you look at Africa. So we decided to study Nigerians, the communications of Nigerians on COVID-19 within this infodemic using WhatsApp as our text. So our main research question is, what are the contents and perspectives of Nigerians' WhatsApp communications on COVID-19? And what is the implication of this for the fight against emerging infectious diseases? And we broke this question into 5 questions, but today we're going to look at just 3 of them. The first one we'll be looking at is, what are the dominant themes in the COVID-19 messages of Nigerians in the UK and Nigeria? We decided to look at the UK and Nigeria to use these 2 as examples to see whether there was any impact of globalization, the spread of disinformation among these people group. And the second question is, what are the sources of information? In other words, the people that spoke within the messages we received, and which of them was most prominent? We also decided to look at the cases of misinformation and disinformation, including conspiracy theories. We decided to look at them and to see whether there was any way you could have the same kind of messages within the people, both in the UK and in Nigeria. So the theory we used includes health risk communication, just talking about communication about health risk, and then globalization in relation to the movement of information, the movement of disease and capital among nations and territories and regions. We also looked at the perspectives on social media sharing behavior, different perspectives by different authors, and also perspectives on COVID-19 infodemic. So these are some of the theories and perspectives that form the framework for the analysis of our results. Our research methods. Our main research method was content analysis, and we just used critical discourse analysis as a supplementary method to analyze the findings from our content analysis. And the period of our study, that's the period that we collected the data that we examined, was from the 18th of January 2021 to the 30th of June 2021. So what we did, we first of all had a pilot study even before this period to see what was going on. And then from this period, we collected data, not only data that they collected from that date, but we also collected data that they had received before that date, but had in their WhatsApp account. So we collected data throughout this period, but it includes data that they had received before the period. And the research participants were primarily Nigerian students from the University of Sheffield and the University of Maiduguri. And we also collected data from Nigerians from different walks of life, from our contacts, those on our contact, the research, myself, the investigator, and my co-investigator as well. So we collected from the people that we had in our contacts and our research list as well. Altogether, there were 88 participants, 18 years and above, that submitted messages, COVID-19 messages to us. We had to get a new phone, a new WhatsApp account, and tell them to send these messages to the account. The messages were anonymized when they sent them, and we stored all of them. And then we had to work with 2 research assistants, one a master's graduate and another a PhD graduate. They were trained on how to code the materials, and they coded the materials we received. For the participants, we had 71 from Nigeria, 71 Nigerians who lived in Nigeria, and then we had 17 who live in the UK. And of all the materials we collected, the highest format was video. About 44.9% of the materials we collected were videos. Images were 41.4%, and texts were 10.4%. We're surprised that audios were not as much as the others. We're just about 3.3% of audio formats that we received from those who submitted. And so from all we collected, we actually had a lot. There were so many, about 1,436. But there were several repeats. Of course, it was an infodemic, so there were many. There were several repeats, and by the time we removed all the repeats, we had a total of 432 messages, 333 from Nigeria and 99 from Nigerians in the UK. So we also did an intercodal reliability test. That's a test that we did among the research assistants to be sure that when they are coding these things, they are doing as much as possible the same thing. And so we had a very high percentage agreement of 99.6%. That means that both of them were coding approximately, or we could say almost the same way. Our findings, we found out that about 54.1%, that's more than half of the materials we collected, discredited official facts about the coronavirus. That means that among these messages, there were those that said there was no need to wear a face mask, or those that said self-isolation was not necessary, or maybe it wasn't important to wash your hands or to minimize that. So all the messages that discredited what the World Health Organization says these are the guidelines for the coronavirus. So this is how the coronavirus came about, things about the coronavirus that were regarded as official facts. More than half of the data were against those facts. But there were also many that advanced the official facts, like told people how to wash your hands, or the importance of washing your hands, and the importance of wearing a face mask. About 21.5% of the content included that as well. We were actually pleased to find that out, because initially we felt that there was just so much of it that discredited official facts, but we did have some medical practitioners come up to say, this is what you should do. We had some people, even government information, saying this is what you should do. Then negative impact of the coronavirus on society was also very large, and that was a cause for concern, because like one entertainer in the video talked about, sometimes the measures to prevent the spread of coronavirus were emphasized without a balancing factor in terms of economic provision. So it looks like there was some sort of political economy in people discrediting official facts, because a lot of people appear to have been suffering. A lot of people appear to have not received any form of support, especially there were videos of complaining about the fact that measures were being put in place without any effort to help the people when they are maybe self-isolating and not doing their businesses and things like that. So when we looked at this, we felt that for guidelines on the check of emerging infectious diseases to really work, then it's important for there to be economic support, not only like those in the UK where some of them had some form of support, but it is possible that some other people, maybe those are residing outside the UK, like Nigeria may not have had the same kind of support that others may have received in the UK. And where we don't have sufficient support for the people, and you tell them to self-isolate, they may choose to say this virus does not exist, because they are suffering as a result of the guidelines that have been put in place. And when they say the virus does not exist and they post things like that, they are not the only ones who receive them. They are received by Nigerians, both at home and in different parts of the world. So it just shows that there is an important need for economic support, not to be looked at only from one nation, because what affects one nation spreads to other nations as well. And in our research, we're kind of advocating a kind of baseline or some kind of thing internationally to say that if you need to fight infectious diseases, then you also need to ensure that there is a balance in terms of economic support worldwide. And also another thing we found that was discrediting government's response to the virus, although that was just 3.5% in our data, but it was also there. There were sources that credited government's response as well. That was quite minimal, like 1.4. And understandably, positive economic impact of the virus was just 0.2. An impact of coronavirus on mental health. It didn't appear that mental health was really discussed much, although when we look at some other parts of the data, it may have been there somewhere, but there wasn't much discussion within the data about mental health. And we found out, we looked at the sources, the voices that spoke within this data, and we found out that the dominant source was entertainers. Interestingly, 21% of those who spoke were entertainers. They were either videos that were maybe ridiculing the coronavirus, or they could be some form of entertainment posters. There was a poster that, for example, said, they've told us that our future is in our hands, and now they tell us to wash our hands. You want us to wash away our future, kind of minimizing the guideline in that aspect. The majority of the content were entertainment. That made us to believe that if really information about the spread of a disease or correct information about the coronavirus needs to spread, then those who are in charge of spreading such information may need to look at entertainment, because our findings show that the videos, materials that really were spread frequently were those that were entertaining. Health workers were also high, 17.8%. And health workers, those we identified as health workers, are those who self-identified, because right now I'm talking about the content analysis aspect. So we're talking about what we saw in the content. But a lot of the health experts from our data also discredited official facts. Interestingly, so as we go on, we'll see some of the arguments. Some of the arguments had to do with the treatments for coronavirus, some claiming that there is treatment, and why are they talking about vaccine? And interestingly, a lot of the health workers as well discredited official facts about the coronavirus. Looking at the data, it could be argued that perhaps people decided to share what they believe. Maybe they chose the health experts that shared the information they wanted. That could be argued, but we are also going to, in the second part, we are going to look at interviews. We're going to interview people to get their perspectives and why people shared what they shared. But for the content, we found out that even health experts shared facts or information that discredited official facts about the coronavirus. Religious leaders were the next at the top of those that spoke, 13.1%. And we also had religious leaders on both sides. What we got out of this is that if we're going to look at opinion leaders or people that health professionals or those who are in charge of spreading correct information, one thing they may need to look at is early consultations with religious leaders. Because from the data, we found out that a lot of people that shared materials from religious leaders. So it can be argued that they are among the opinion leaders when you talk about these messages that spread within the infodemic circle. Political leaders as well, 10.8%. Although we actually thought political messages from political leaders may not be so much because of previous literature that talk about people not trusting political leaders. But there were also some things that were created by political leaders that were also in the circle, like videos that talk about the coronavirus and measures. So those things were also there, but it's still important to know that entertainers were still the dominant voices there. National health organizations also were among the top 5 dominant sources. So what we see from this data is that it's important to look at all of this, but those who produce those messages need to take note of the fact that there are some types of messages that spread more than others. So when they're spreading things, they should try to create a message that can spread, because if it doesn't spread, then there's no need. If it's too much of hard facts don't get spread as much as entertaining facts, from what we saw in this in our study sample So the dominant themes by entertainers. So we've said entertainers were really high, about 21% of those who spoke and their messages were spread were entertainers. But when we look at it, we found out that most of their messages actually discredited official facts about the coronavirus. Some did advance official facts, correct what you would describe as correct information based on the World Health Organization facts about the coronavirus. Some did, but majority did not. It still boils down to wondering, why do we have such high levels of distrust in this circle? An example of the entertaining messages is this video that it's there. I'm not going to play it there, but let me see if I can just share a link if it goes. If it doesn't, I'll just explain I can still explain what's there. I've just shared a link there. You can watch it in your own time, but just to explain what is there, it's just an example of the entertaining video. This one just subtly discredited the existence of a virus. It's just someone who she behaves like she's into a phone call with somebody and then asks the person, I was asking them, have you ever seen anybody that contacted coronavirus? They said no. I asked them, have you seen somebody that knows somebody that knows somebody that has contacted the virus? They said no. And she starts with that, and then it moves gradually into music and then into dance. Now, it was entertaining, but while one will not encourage the spread of wrong information or trying to make people feel that the coronavirus doesn't exist, but we feel that there is something to learn in the format of the message, that it was so creative to begin to start something with a message. The message is subtle within it, but it went into singing and dancing and something that was attractive for people to watch and laugh. At the end, she just laughed over it. But at the end, it's like, this virus may not even exist, and they laugh over it and then go. It's important, the kind of message that goes on. While some people may just take it as fun and laugh, depending on the number of factors, some people may actually believe such stories. So while the message is not to be encouraged, actually the format, the creation, the creativity in producing something that spreads wide is something that I think that people who produce correct information need to also learn. There's another example here. This particular example does credit official fact. It talks about self-isolation. So you see the woman there. Let me see if I can get the link and share it with us as well. You see the woman there that comes, she's with this headgear. She comes to visit her nephew and his family when there was self-isolation, because she felt self-isolation period was a holiday period. So she was going around the community visiting people and trying to hug them, and feeling that there's no coronavirus, they should forget it. I just put the link there in case you want to watch it later. But there's also creativity in this one. And I think perhaps this one got shared because in the midst of saying, oh no, you need to self-isolate, you shouldn't have come to visit us at this time and things like that, there was some kind of fun in the whole thing. Creativity was there that may have prompted the sharing of this particular video. Then we looked at emotions as well, emotions and reactions within the content that we collected. And we noticed that laughter was very high. So we would have thought that something that has to do with the coronavirus would have had maybe more of fear. Fear was high, but laughter was 28.1%, which was the highest reaction we saw. And I think this agrees with the fact that entertainers were the highest. So any content that had some form of entertainment spread faster than others. But anger was also there, 19.2%, and fear was 18.5%. So when we looked at the data, what we draw from this is that the laughter may not just be because people don't care. It may be some form of escapism. It may be that there was fear, yes, we can see there was fear, there was anger, but people kind of formed a coping mechanism, a way to be able to laugh away their fears, forget about their fears. So we feel that it's a kind of coping mechanism that may have brought the laughter to be at the top. The least prominent sources we have listed there. I'm just going to talk about the coronavirus victim there, which was 2.3%. Coronavirus victim being so low is a cause for concern, because we would have expected that people who were affected by the coronavirus will come up to speak, so that people will see that as an evidence that the coronavirus does exist. And we saw that there is need for the voice of more people who are affected by the virus to speak within these circles. There wasn't much of such within the data. Yes, we also looked at misinfodemic and disinfodemic. Like I said, infodemic is the high spread of huge amounts of data, inaccurate and accurate data about the coronavirus. But we're looking at misinformation and disinformation, including conspiracy theories. We couldn't completely, it was difficult for us to say something was disinformation in the sense that there was an intention to deceive, because it's content analysis. We can't see it from some of the content, but it's not very obvious in some content whether the aim was to deceive or not. For example, in the entertainment video, it wasn't clear whether the aim was just to entertain or actually to deceive. So we grouped them together. We did not separate misinfodemic from disinfodemic. The highest among the misinfodemic on the origin was that COVID-19 is caused by 5G cellular technology. And we had different groups of people, different voices advocating this. And some of them describe themselves as experts, as I'll talk about later as we go on. And then the next was that COVID-19 was created by wealthy people to make money. That was also 5.7%. And then there was the argument that it was created by Western elites to control the world, like a new world order. Also, another theme there was that COVID-19 was created by the US to wage war against China. We did not add the comments on China into this particular list because there were also those that argued that it was from China. We have attributions in some other part of the study which we'll deal with, but we'll not talk about that today. But among those that talked about misinformation about the origin of the virus, they were altogether 17.1%. And you can see the ratio here in this particular pie chart. So we observed that only 5% of those in our data said coronavirus doesn't exist at all. And what that tells us is that it's possible that many of Nigerians in the UK and in Nigeria do believe that the coronavirus exists, because the ones that had the misinformation about the existence were 17.1%, but the ones that said it's a hoax, it's not true at all, those were just 5%. So weighing the two together, when we look at the information, the inaccurate information, we found out that more people within the space of this infodemic believe that it exists, that it came from something that was not said to be the origin in the World Health Organization's information and reports. Only 5% said it doesn't exist at all. And also, before I come into the characteristics, I also want to mention that the highest amount of data, one of the challenges within the data was misinformation on that the guidelines. Let me just talk about information guidelines. There was wrong information guideline. That's, we noticed within the data that some messages that were meant for other countries were shared to people from other countries and discussed as if they were meant for those countries. So there was transnational confusion of guidelines. For instance, using my own experience, in one of the WhatsApp groups I belong to, there was a message that was for Northern Ireland, and it was shared, and people thought it was for Nigeria, and I started discussing it as if it was for Nigeria, until somebody in the group had said, no, this guideline is not for Nigeria, it is for Northern Ireland. And that's the level of globalization that we experienced in the data. And for our study, it makes us to suggest that messages that are sent out, guidelines that are sent out, should have some form of signpost or some form of information at the top or somewhere prominent that says this guideline is for this community or is for this particular nation. Because with the rate of information spread, you can't just assume that because you share the message, it belongs, it's only going to be received by people in your location. So it's important that any guideline that is being shared, and that it's possibly such a guideline that can be shared on mobile technology, like mobile spaces like WhatsApp, it's important that they state the country they belong to, because we identified confusion in guidelines even among different nations. So characteristics of COVID-19 infodemic on WhatsApp. We noticed source entertainability, and just like we talked about the entertainers being the prominent source. So any text that had some form of entertainment was now shared more frequently. There was also source expertise. So some people within the sources try to say, look, I am an expert. For example, I'm an engineer. There was one particular text that someone says he's worked in Vodafone, he's had his own company before, and he can't speak as an expert to say that coronavirus was created from 5G technologies as a result of the 5G technology. So we see people claim expertise, and people want to spread messages they feel are from experts. So that's one of the things we noticed then. So when the source claims that I'm an expert, people tend to believe what they say or share what they say. Also, there was this source followership. So we believe that religious leaders were there because they have followers. They may have a congregation, they have people, so it can spread. So it's important that if correct messages are going to go out, then the people who are doing this need to also take note of those who have high followership, because they have people that they share these things to. So one of the characteristics we saw in the message are people who spoke and their things were shared are those that would normally have high followership. And we feel there is source trustworthiness. I put to be confirmed by our qualitative study there. But we see that some of the people within the message will say, look, I am your pastor, I'm your leader, I am this, or family, friends. So those that they trust, they kind of share their messages. And there's this also the source or the speaker saying, I am your savior. For example, I'm going to help you understand what's going on. You don't understand what's going on. One of them said that there's this kind of world order that's going on. It's going to help them understand what's going on. And what it's going to do is promote a new currency for Africa so that they are not controlled by the world order. He said he was an expert that was discussing with a lot of presidents about it. And so that's another thing. So the source as a savior. And then there was also the request to forward strategy, where each message says, after you've read this, spread it to others, let others know, forward the message. That's another strategy that we saw within the data. So I'm going to end up very soon. And so we've looked at all of these. The research question is, what are the contents and perspectives of Nigerians' WhatsApp communications on COVID-19? And what is the implication of these for the fight against emerging infectious diseases? And the theories that we based our analysis on include globalization, health risk communication theory, and perspectives on social media sharing behavior. Our main research method was content analysis, and then we also use critical discourse analysis to explain the data of the content analysis. We have another aspect of this research that deals with interviews, but I didn't go into that one today. So this study suggests that the top opinion leaders in Nigerians' WhatsApp communities are entertainers, health experts, and religious leaders. And we will suggest that those who are in charge of disseminating information need to look at these opinion leaders and, if possible, have consultations with them at the start of emerging infectious diseases. When there's a public health emergency, before it begins to go far, it's important that these people, which we identify as key sources in the data, are spoken to and carried along. And the top miss of this infodemic content was misleading guidelines actually on COVID-19, and also that the COVID-19 vaccine will be unsafe. So we found out that a lot of the people did believe that the virus exists, and they did not trust the COVID vaccines. They felt it to be unsafe. so we wouldn't want to take it. And also, we want to recommend that there should be more creative presence of official facts in infodemic spaces. There will be infodemic when there is an emerging infectious disease. So those who have the correct information need to be more present within infodemic spaces. We've talked about consultations. I've talked about consultations and literacy for opinion leaders already, and also that there is need to balance health and economic well-being for successful implementation of safety measures during times of public health emergencies. So it's not enough to give guidelines to people. We are advocating an international baseline for the balancing of guidelines with welfare of the people. So, and that's all from me. Thank you very much for listening.